Hi, Eid Mubarak to everybody shooting on this auspicious day. Also, it's the second day of Navratri. uh, let's start with another question of the ADC exam. I've just come to the clinic today, though it's an off. I had to do some website work, so I thought might as well just carry my laptop, shoot one video quickly because lots of work in the evening otherwise. So we are solving another SBQ of the mock 20 paper, and this is a little out of dental scenario, but you may experience this and you should know how to handle such cases. So let's see. A 13-year-old female teenager patient is visiting your clinic accompanied by her mother. Okay. She complains of occasional sensitivity. Occasional. So it's sensitivity, there's no pain as such. It is worth noting that her parents are going through a divorce and she expresses a sense of not being cared for. So basically, she is a teenager and she feels she's not being cared for. She's under stress. Expect some kind of rebellious behavior. So she may not listen to you. So you'll have to give your suggestion based on her psychological status at the moment. Okay. That's why the age and the story has been mentioned, so you're aware of all this. Now, her mother is concerned about her daughter's interest in getting a mouth tattoo and tongue piercing. Mouth tattoo and tongue piercing, okay? I really don't know what mouth tattoo is. Tongue piercing, I can understand. She shares that some of her daughter's friends of the same age had these procedures done and experienced infections. The mother seeks your advice on the matter. This is one of the scenarios that you can see in the developed world. I'm not saying anything against anyone, but I don't ever see this in India happening. Like, I don't think so. I have the guts to tell my own parents I want a tongue piercing. I think they'll directly give me a tight slap on my face, to be honest. So, yeah, but I think a lot of things are very liberal in the developed world, which is nice in a way. This is just on the joke side, okay? I'm just kidding. I don't mean anything what I just said. So, but it was just fun and I had to say it. So, anyways, let's go and study about it. So the mother is asking you for your opinion. And so, example, you're sitting in a clinic. The parent comes with a 13-year-old and says that this girl wants a tongue piercing and a mouth tattoo. Doctor, what do you advise? It's ouchy question because you cannot directly say no to the girl. She's your patient. But yeah, you have to do what is right in a very subtle way without instigating the patient, or the reverse psychology kind of a thing. You can't do that. So, anyways, let's see the options. What we have here: advise the patient to get it done when she's an adult. Not a wrong option, actually. As an adult, she's free to do what she wants. Advise patient's mother to investigate if the tattoo artist uses sterile needle. See, the child is 13, and at least till the age of 16 or 18, the child is still a child. So you cannot encourage the mother that go and find out if everything is sterile and it's okay to get it done. No, the child is still 13. It's not okay to get it done. Encourage mouth tattoo and tongue piercing as they do not cause any infection. They do cause infection if not done appropriately or otherwise. So you as a person cannot encourage because it's not appropriate. It is illegal in Australia to have oral piercing. No, it is not illegal anywhere in the world. Discourage tongue piercing. Now, at that particular age, option E is the right answer. See, option A is not wrong, but the patient has not come to you as an adult, though you can tell her, advise the patient to get it done when she's an adult. But at the present moment, if the mother is asking, what should I do? My 13-year-old daughter is asking, then first I would discourage. Then I would choose the option A. If option E is not present, then I would choose option A. So both the options are correct, but I feel choosing option E is the more appropriate in this one. Now, who is responsible to give consent? I've given a very detailed explanation for option E in the solved answers. So whoever is solving this mock, my enroll candidates will give a detailed answer about it as to on what age you can do what. Who is responsible to give consent for her tongue piercing? At the given age of 13, if a consent has to be given, it has to be by her mom because she's just 13. If she was 18, then it was herself. The family doctor doesn't come into picture. You notice that the girl doesn't care about her appearance. She brushes her teeth few times a week, okay, and doesn't floss. You need to give her oral hygiene instructions. What will you base it on? Okay. So you see, it's a 13-year-old. She's mature, she understands, she knows what she's doing. You cannot reprimand her. So, how would you motivate her to do more? Like, what kind of language, tone, words would you use? All these things would be based upon her psychological stress as a teenager. See, even when I see a lot of 13-year-olds, not to everyone, even though the complaint would be the same by all of their parents, the child is not brushing. I just don't start saying, you have to brush 2 times because it's this. It's like I'm giving a monologue and the child is not even listening. Each child's response to why he's not brushing properly is different. So first you have to understand on basis of that you have to say, for example, sometimes the boys and girl have different responses now. So example, there was a 13-year-old patient and mother had the same thing. The child doesn't brush at all. So I asked him like, why you don't do that? Like, what is your reasoning behind it? So this child says, I don't have any cavities, so why should I brush? And he was right. I did the oral examination. Unfortunately, he did not have any cavity, neither plaque, no calculus, but he had very thin, watery saliva. He was blessed with it. So I can't tell him that, brushing twice daily would help you not have cavities because he already has an answer to that. I've not been doing it and I don't have a cavity. So, based on his answer, I had to change my response and I motivated him by saying something else, which appealed to his reasoning and logic. And the next time when he came, he was like, now he's brushing. Another scenario, the patient said he doesn't have time in the morning to brush properly, and that's why he can't do it, or at the night he's too sleepy to do it. So I'm like, you have a valid point. So how about you brush immediately once you have dinner and not wait until you go to sleep? And appeal to him. So you just can't keep on giving a monologue to every patient, like repeating the same thing. You have to first understand why they can't do it or what is stopping them from brushing properly, or do they need more scientific evidence? Some children do ask, like, why should I do it? So then you have to give, I actually say in layman terms, the entire science process. And even the parents sometimes, are very impressed by it, that sometimes they feel, no, why don't you just listen to what the doctor is saying? And I'm like, no, just relax. The child is actually curious and wants to know why he should be doing a particular thing told to him. And once the child understands, then they themselves say, you know what, I'll be doing it. And they do it. So, whatever instructions that you as a clinician are going to give to the patient, it should not be a monologue. Like, if you want to become a good clinician, ask the patient what is happening, what is their thought process about it, how much do they know about it, are they interested in knowing more about it, etc. So, everything is dependent on their psychological understanding. So B and C options are not relevant here. Her mom's neglect of her. A 13-year-old, what mom is going to do? Like stand in the bathroom and brush the girl. She's 13. She kick her mom away from that place. So the patient asks for advice about what to check out about the tattoo shop. Now the patient is asking, not the mother. So example, the child patient asks, no, no, I might go to the tattoo shop later in my life, and what do you think I should look up for? So you would be saying an autoclave for sterilizing non-disposable instruments, true. Sterile needles used only once, true. New gloves used for each procedure, true. It's pretty much how you are doing your clinical work, the same things. It's all of the above. Any piercing, any invasive procedure which causes a breach in your skin should be followed, all these protocols, sterilization, everything, etc., etc. You are, after all, doing a procedure on a human being and you don't want any wrong things to happen. So you follow the protocols. So the answer is all of the above. Now, how long does it take for the tattoo to heal? Now, this is not a dental question. I've never got a tattoo done before, but I have friends who have done, and whenever I've asked them how long it has taken for it to heal, they always say sometimes 2 weeks and sometimes 3 weeks, depending on the size of the tattoo, etc. But minimum, they say for a week or 2 weeks, they cover that tattooed part and try not to put water on it. So based on that, 7 to 10 days is the answer here. And I also Googled up, so it is it's actually 10 to 14 days, but the closest option here is 7 to 10 days because the rest of them are very less. So if you are one of those persons who have got a tattoo, leave in the comments how it is. Honestly, I do have a desire to get a tattoo done on here, my forearm. I want to write Faith or Krishna, anything. I'm just scared because I feel it's gonna hurt me a lot. Yeah, I know it's ironic because I keep on giving injections daily to children, but I myself have phobia from needles. You know, I can't take one. I'd rather be put under general anesthesia even for an IV. You know. So imagine getting a tattoo is like next level for me. So all of y'all, anyone who has got a tattoo, leave in the comments. How was your experience? How did it feel? What kind of tattoo you have? And most importantly, I want to understand why people get it done. Like, even I'm not able to understand why do I have the desire to get it done, but what is your take on it? So yeah, it's a nice question. Nobody in my family ever has a tattoo, like all my extended family. I think if I get one, my parents are going to like roll up their eyes and they'll be like, "Ye ladki haath se gayi." I don't know, she's becoming a hipster or something. So, anyways, motivate me, guys. I just want to take this step once, but like, what can I do to not feel the pain? You know? So, yeah, write your experiences about it. So, have a nice day. Bye bye.